welcome. How many of you suffer from headaches? Headaches can be debilitating. They can interfere with your relationships, with your movement, with your food choices, with your joy and vitality in life. Let's explore what we can do about them. This is Dr. Wendy Lee White, and I'm here in my free weekly webinar, Tune Into Your Body. Today is episode 23 of my weekly webinar, Tune Into Your Body, and we will be talking about headaches. So when you come into my office complaining about headaches, whether they are sinus headaches, headaches of unknown origin, migraines, rather than saying, here, take this herb or nutrient or supplement, it will make your headache go away when you get them. I want to know why your body manifests headaches. What is it trying to tell you about what it needs? No symptom that the body produces should be ignored. We are amazingly, beautifully designed creatures, and any symptom that we have is an information provider. And my job as a licensed naturopathic doctor is to take all of those symptoms, all of those clues that your body is giving us, and decide what the underlying cause is that we need to address to help rebalance the needs of your body, so that it has no need to create a symptom to tell you anything. So welcome. I'm glad you're here, and I'm hoping that you can take away something from today's webinar that will help guide you to solve your mystery of your headaches. So welcome if this is your first time. Welcome if you are a returning webinar registrant listener. My Tune Into Your Body webinars are based on my 5 essentials for you to be healthier every day. Those essentials are nourish, move, choose, connect, and balance. And so today, as we discuss and explore the cause of your headaches, we'll use that as an outline to really explore all the different ways that the 5 essentials can contribute to your body being out of balance. So as far as headaches go, let's start with the first essential of nourish. Now, what's included under nourish are food, hydration, and supplementation. Those are the 3 items under nourish. So let's explore the idea that food intolerances or sensitivities might be a contributor to headaches, dehydration, and under the supplementation aspect, let's talk about magnesium deficiency. So the first idea that food intolerances or sensitivities could contribute to headaches, that can be explored either through a trial of foods, herbs, and nutrients to help heal the tube that is your digestive tract and see if your headaches ease. So that's using a therapeutic trial of supports. The other option is to do some food sensitivity testing and then responding to that testing. For those of you who like to see results in black and white on paper or in color on paper, then the testing can be helpful. The testing tends to run between $100 and $200. So the testing is for people who really like to see the results, and that helps motivate them to make choices. But really to do a therapeutic trial of GI support is often needed anyway, because most of us have digestive tracts that could use some support. And if we look at the food intolerances or sensitivities, they are not the root cause. The root cause would be digestive irritation or GI tracts that need support and healing. when practitioners really focus on you have to minimize or avoid these 20 foods, in my opinion, that's not the root cause. Your body's not designed to be highly reactive to foods. The root cause would be the immune dysfunction and the GI dysregulation, the GI inflammation. That's the root cause. The food sensitivities or intolerances are just a symptom, just like your headaches. So that's one thing we explore when we are looking at causes of your headaches and trying to solve the mystery of why your body tends to get headaches. Dehydration is the second topic under Nourish that I'd like to discuss regarding headaches. And again, this is about increasing your awareness and your mindfulness around your fluid intake and your level of perspiration and the level of hydration the day before and the day of your headache. Try drinking 8 to 12 ounces of water and see if you find relief. Now, many people ask, how much water should I be drinking? And that, of course, varies. It varies based on your body size, your metabolism. It varies based on your level of movement and perspiration, your amount of kidney filtration and your urine output. So rather than using an external guide, I like to just guide people to the amount you're urinating. And if you're urinating every few hours and it's pale yellowish to clearish, then that's probably great. If you are urinating once or twice a day and it's dark, you probably need to increase your fluids. If you are urinating every hour and it is always clear, consider the fact that you may be overhydrating and therefore you might be actually spilling minerals into your urine, wasting good nourishment. So often I will guide someone to their inner cues. And that's how we decide if you're having enough of something or too much of something or too little of something. So let's talk about magnesium deficiency as possibly another contributing factor to your headaches. Now, this is a tricky one. If you're low in magnesium, you might think you found the root cause, similar to food sensitivities or intolerances. You might think that's the root cause. But why you might be magnesium deficient, therein lies the potential root cause. It may be back to the fact that you're eating foods or not eating foods that are high in magnesium, or if you're eating foods that are high in magnesium, like nuts and seeds and green veggies, maybe you're not digesting and absorbing well. Back to GI health again. Maybe GI dysfunction might be one of your root causes. Or are you taking too much of something else like calcium? That calcium magnesium tend to do this teeter-totter balance in the body. Are you taking too much calcium, which is creating a relative magnesium deficiency enough that you would be feeling deficiency symptoms? So can you see why I think you should work with a licensed naturopathic doctor rather than self-prescribing supplements, Band-Aids? It's not always the root cause you're addressing, and you may complicate things by adding other variables that are really not a cause, but they're creating other imbalances in the body. So that is Nourish, number 1 of the 5 essentials. Number 2 of the 5 essentials is Move. And as we're addressing the root causes of potential headaches, we talk about active movement and passive movement. So active movement includes your posture, the ergonomics of your workstation. Is your keyboard up here or is it down here and you're all hunched over as you're working all day? Are you moving your body or are you seated in one position for 8 to 10 hours? Things that physically you're moving actively to increase circulation and get blood flow to all areas of your body. So for active movement for someone with headaches, I'd look at movement patterns, tension patterns in the tissues, and areas of stagnation, areas that don't get much active movement, where things just kind of get a little thick and not oxygenated, not full of nutrition. This is where referrals to chiropractors, body workers of all sorts, massage therapists, myofascial release, craniosacral therapists, or to physical therapists, personal trainers for postural assessments. All of these things that are contributing potentially to your headaches. Passive movement, which also can be a therapy for headaches as we continue solving specific mysteries. So how this looks, everyone's always like, what is passive movement? For me, most of that is hydrotherapy, using hot and cold temperatures to drive circulation in and out of certain areas. If you struggle with tension headaches, the tension from this upper back neck, when your shoulders are buried up in your ears and the weight of the world is just a lot. Tension or sinus headaches are often relieved by a hot foot bath. Why would this work, you might think? When you put your feet in nice warm water, it's so comforting, first of all. And second of all, the capillaries in the blood circulation of your feet then open. As they open, they want blood to fill them, which drains a lot of your circulation into your feet, pulling it down through your body, away from your head, into your feet. This, if you have sinus congestion or tension in your head, helps to drain that out. Migraines, on the other hand, often respond favorably to a cold foot bath. Something to try to see if you can solve your discomfort. Now, I caught myself there. We're not solving the root cause of the headache, but we are helping to ease your discomfort as we continue to look for, why do you tend to have sinus congestion? Why do you tend to have this physical tension in your upper body? But the hydrotherapy, that passive motion, can really help ease your discomfort as we explore. So for those of you who just joined us, welcome. This is Tune In to Your Body. I am Dr. Wendy Lee White, licensed naturopathic doctor, and this Tune Into Your Body is episode 23 of my weekly webinars. And episode 23, there was something else I was going to say about that. I have no idea. And today we're exploring headaches, and we're applying the 5 essentials for you to be healthier every day to headaches, to helping you ease your complaints of headaches. One moment while I let my dog in to my room, because I can hear her pacing out of the door. So we started talking about nourish. We worked on move. Now we're talking about sleep. And sleep, hello, my girl. And sleep, chemical exposure, and lifestyle patterns fall under this choose section. Now, how we can apply it to headaches. Chronic sleep deprivation can be a large contributing factor to headaches. Now, if you're not prioritizing sleep and you're lacking sleep just because you haven't scheduled your life around what's important and what you need, then that may be the root cause. However, if you struggle to get good sleep, the mystery is to solve, why are you struggling to get good sleep? What would be the root cause underneath that struggle? Hormones, blood sugar dysregulation, emotional disturbances, a partner who snores. Those would all be possible root causes to investigate. Let's shift to chemical exposure under the heading of choose. Now, it may be you're an artist and you often work with solvents and paints, and that gives you headaches. Do you need better ventilation or a respirator? Were you just living in the Pacific Northwest and you had wildfire smoke around you for 2 weeks that gave you a headache and that made you feel queasy? Could you have an air purifier? Can you increase your level of liver support so that you're detoxifying as quickly as your body is being exposed? Lifestyle. Are you running in 18 different directions throughout any given day and your head is, quote, spinning to manage it all? That's realistic to be an underlying cause of headaches. Remember, your mental, emotional, and spiritual being has a direct effect on your physical body. So maybe exploring non-physical causes of your physical complaints is worthwhile. That might be a referral to an energy medicine practitioner or a Reiki practitioner. That might be referral to a somatic experiencing or somatic meditation instructor or a therapist who does somatic therapy and linking your physical experiences to your mental, emotional, or past traumas. All of those, sleep, chemical exposure, and how you're living your lifestyle, can be contributors to your headaches. The fourth essential for you to be healthier every day falls under connect. This is where your relationship to yourself, to others, and something greater. Those relationships fill a biological need that we have as mammals. Your lack of connections can lead to real tension. Then think about the move section above to release some of that tension. But the physical tension would not be the root cause. The root cause might be your loneliness and you're feeling disconnected from those around you. We are not just physical creatures. We have emotional needs that, if not met, can create physical ramifications. Let's talk about balance. The fifth essential for you to be healthier every day. The state of your nervous system dictates where in your body energy and nutrients are directed. If you're constantly living in threat or reward state, that's that sympathetic dominance, your body wants energy and focus in your muscles and in your brain so that we can fight or run or scheme. All that amped upness can surely create high blood pressure, as can magnesium deficiency, by the way. And you know what high blood pressure can cause? Headaches. Conversely, to that threat and reward states, that sympathetic dominance, the more we create to seek safety, parasympathetic, the greater ease your body has to have effortless function, the less it needs to create symptoms to get your attention. Bye-bye headaches in that case. So those are the 5 essentials for you to be healthier every day as they can be applied to finding the root cause of your headaches. I'll give you a couple of examples of patients. One patient presents into my office in her 60s with migraines for decades. She has not had relief from the doctors she has seen, from physical therapy, from trials of pharmaceuticals that are designed to ease migraines, either in prevention or treatment. And she has not really explored natural medicine up until seeing me. Now, she's a blood group A. For those of you who followed me, I do use blood type as one piece of the puzzle for you. And so she's a blood group A. She also has digestive difficulties. She often feels bloated, having indigestion, feeling like she's not digesting super well. One of the therapies we discuss is having raw apple cider vinegar in water before meals to help see if we can stimulate the production of stomach acid so that she then would digest each meal more completely, which would A, irritate her system less, B, increase her nutritional status, and C, ease her discomfort of feeling bloated and like she's having indigestion. She, within 2 weeks, notices a benefit of having less migraines. Within the next 3 months, she's down to counting migraines on a monthly basis rather than on a daily or weekly basis. And the only thing that she took away from the first office visit, because she was been a very sensitive being and wanted to be one thing at a time, so she could really see if she didn't feel so well, she wanted to be able to know why. So she only added the apple cider vinegar to her routine. Super easy. It doesn't always happen that way, but sometimes it does. Don't discount the easy things on your treatment plan. Sometimes that's all it takes. Our bodies want to be well. Our bodies want to be in balance. And if we can support them to do that in these very simple, easy things, great. Another example that I'd like to provide regarding headaches is another female who comes into my office, and her underlying cause that's identified is really she has tied her headaches with her sinus congestion. And so when we do some sinus clearing through neti pots and a product I like called X-Clear, that is a nasal spray that has some antimicrobial properties and some soothing properties, she finds that her headaches are less. They're less in frequency and they're less in intensity when she can keep her sinuses draining. Now, that's not the root cause, because why will her sinuses continue to be stagnant, swollen, full, and reactive? That is looking into that, the answer of that question. That's where we come up with the root cause. Now, in this case, we're exploring some mold sensitivity and some immune dysregulation as the root cause of her headaches through that sinus stagnation and that sinus reactivity. And of course, I can give you plenty of examples of people who really needed some physical attention to their bodies, that they weren't moving on a regular basis. They weren't paying attention to their posture, their ergonomics. They didn't know that that injury they had created a pelvic tilt that then set off a chain of imbalances throughout the rest of their bodies that were causing their headaches. I had a patient in Connecticut who was having daily headaches, taking ibuprofen and Tylenol every single day. And honestly, he only drank coffee. When we minimized his coffee, not eliminated, but minimized his coffee, increased and introduced basically some water, encouraged him to eat more than he was eating. He was really only eating one meal a day. We were able to get him off Tylenol and ibuprofen for his headaches. His headaches went away. He also began to notice shifts in his back pain and his inability to sleep because of his back pain, all because we decreased his coffee, increased his water, and encouraged him to eat more than he was already eating. So I'm going to wrap this up here. Again, this is Tune Into Your Body with Dr. Wendy Lee White. I'm a licensed naturopathic doctor, nutritionist, and educator. This was episode 23 of my free weekly Tune Into Your Body webinar. And today we talked about the 5 essentials for you to be healthier every day to solve the mystery of your headaches. This does not have to be complicated stuff. Looking at how you nourish yourself, move, live your life, connect with others, and balance your nervous system can really help to ease and solve the mystery of your headaches. Until next week, please do take care. Reach out if I can be of support to you. Thank you and have a great day.